Back with Dr. Vuong, a dentist in Washington, the beautiful state with beautiful apples. Do you guys really have apples up there in Washington?
Oh yeah, a lot of apples.
Or are you importing them from Taiwan and then sell them to us as Washington apples? I mean, what's the deal?
Definitely not. We've got all the apples out here, and we're exporting them to the whole world.
Come clean, doctor. Okay, I'm not so sure about this anymore in our world economy here. All right. Good. Dr. Vuong, I'd like to talk gum disease, periodontal disease, gingivitis, all the same thing, just a little different stages, you know. Gingivitis a lot less than, heavy periodontal disease. So, just about every dentist will say you gotta avoid periodontal disease because you are going to lose your teeth down the road. Besides the fact that you gonna to be smelling awfully bad and your social life is nixed, finished, done, over with. But you're gonna lose your teeth. Now, while this is probably true, and for sure true, while this is probably bad, the fact is that dentists like you make wonderful bridges, wonderful crowns, even wonderful implant-supported denture, which are really quite cheap, and you get a whole set of teeth for just a few bucks, basically. And they are very, very good, those implant-supported dentures, so I have heard, and we're going to talk about it. So the point is you can fix the whole baby again. But here's what I think is a more devastating thing. You have a disease in here. You have an infection, which is a huge infection. And it's like that yellow reddish pus, that thing which poisons, and goes into your blood. In fact, your mouth is the gateway of the blood vessels. I mean, if a guy's a little bit unconscious, just put something under his tongue and he goes, ooh, and he's back to life. So it's going right in it. It trips in it. It ruins the kidney, it ruins the livers. I have heard that babies get born premature and underweight. In California, we even had a stillborn baby because they found gum disease pus in the placenta of the lady. On and on it goes. Immune system basically goes whoosh down. It looks to me that those effects are much more difficult, if at all, to cure. New teeth, if you have the money, you want to pay 5, 10, 15 grand, get a new set of teeth, fine, no big deal. Fix your liver, your kidney, your stomach, heart disease, strokes because the blood is poisoned, a different ballgame. How wrong am I there? Am I exaggerating here, or what is it? You tell me. You're the dentist.
No, you're definitely right. Periodontal disease have always been associated with low birth weights, cardiovascular disease, liver problems, kidney problems. It's really, like you said,
diabetes. I've heard diabetes.
Diabetes is huge. The mouth is part of the body, and we can't just keep, our whole body healthy without keeping our mouths healthy. The mouth is connected to the body, so we must treat it as a whole. And periodontal disease is kind of like the foundation for our teeth. So it doesn't matter if you have $1 million house, which is like, your teeth. If you have perfect teeth and you don't have a foundation to support it, it doesn't matter. You're going to lose them.
Right. So very obviously, somewhere along the line, whoever made our bodies, let's say it's God, and that's probably what it is. He put lots of important stuff in that little tiny head up here, and obviously he made the whole thing working in big synergy, and more doctors come to realize that is. For instance, over the last few years, 2, 3, 4 years, really not all that long, it becomes very, very common for just about every surgeon, be it a hip surgeon, a guy who takes out appendix or the tonsils, before he engages in the surgery, he's telling the patient and says, go to attend, except if it's, emergency surgery, like taking out a bullet of a guy, then he probably doesn't do that. But like rather than that, those planned surgeries, the surgeon goes and tells the patient to go a clean bill of oral health from a dentist, because he says, if you have a gum infection, your body is so weakened that if I cut you on this other end, be it the tonsils, the stomach, the liver, the hip, the knee, I am endangering your body. Have you noticed that? Is that becoming a bigger trend than ever before?
Yeah, that's definitely true. I've seen many specialists refer patients to my office for a thorough oral evaluation, and especially a thorough periodontal evaluation, because they don't want bacteria from our mouths passing through our mouths into the bloodstream and then affecting their surgeries. Like, for example, let's say a patient's getting a hip replacement. They definitely want to, get a thorough dental exam and take care of any dental problems and periodontal problems before their big surgery, before their hip surgery, so that bacteria doesn't come back and cause an infection to their hip surgery.
Right, because the body's immune system basically is weakened, because all the immune soldiers, let's call them immune soldiers, who go out there to try to kill up the free radicals created by this gum disease, they're needed for the gum disease. I've heard that a gum disease is about 9 square inch. That's about a hand. Big. I mean, if people have a little tiny, half an inch, like a dime, like a penny, on their hand, on their skin, on their dough, they run to a dermatologist immediately, as they should. But they're not doing that with 9 inches of disease. Isn't that amazing?
Yeah, that absolutely is. And a lot of times it's just patients not being educated about it. And I think
maybe really it's you dentists not being bushy enough about it.
That's true too. As dentists, we try not to offend our patients too much, but it is our job to try to educate them and tell them the truths about gum disease.
Very
and
much
how
so.
It can affect their bodies.
Very much so. I mean, because after all, we patients too come to you for help. Grant you, we try to put you guys into the category of a car salesman and a guy who sells couch and carpet and whatever, and we try to bargain, and we try to say, well, I like that or don't. Well, look, whether you like a root canal or don't like a root canal, or whether you like gum disease surgery, periodontal surgery or not, has nothing to do with whether you need it.
That's true. That's true. It is definitely our job to inform the patient. It's the job of every dentist to inform their patient of cavities, periodontal disease, anything that they should know about, any diseases they should know about their own mouths.
And I think in terms of, as I said at the beginning, most dentists talk about the fact that you lose your teeth. And while that is very bad, it's 4, 5, 7 years down the road, and it can be fixed even, you know what I mean? Yes, the guy looks ugly in between, and yes, he has to spend money and all that stuff, but at least it can be fixed. But while this is going on, his body is rotting away.
Yeah, no, that's definitely true. If you're harvesting all this bacteria around your teeth and around your gums, every day this infection from your mouth is actually invading your immune system and causing your immune system to weaken every day. So it's definitely, gum disease is definitely something that needs to be treated, and if it's left untreated, it's just like your whole body is
I wouldn't even bet, and you tell me whether there could be anything right to it, that, as such a weakening of the body, if it can weaken the body so much and can literally ruin the body. I mean, if your liver, your kidney and things not operating full, don't you think that the person will be slightly more fatigued, exhausted, not quite is normal on an everyday, and the smallest flu season, never mind swine flu or bird flu, but the smallest every year flu season once or twice these days, will kind of give him that, that flu.
No, I definitely agree. But I think what happens to patients is because periodontal disease is kind of a chronic thing. It didn't happen overnight.
Right.
So slowly, day by day, their immune systems start to weaken, and they start to feel more fatigued and more tired and just have less energy. But they just don't realize it because it happens so slowly over a course of time.
The dimmer switch. You know, you sit there at 4 o'clock and your wife comes home at 8 o'clock and turns on the light and says, "What are you doing, honey, here reading in the dark?" You go, "Oh, didn't realize." All right. Well, I appreciate your candidness. Let's hope that people watching this video will actually do realize that, lots of their bodily problems might simply come from a gum disease. Go fix it, check it, keep it in check, because it's an ongoing thing. It's like eating. You don't eat at Thanksgiving and then say, "I'm done for the rest of the year." It's just not how it works, and that's just all there's to it. It's how it is. Thank you very much, Dr. Vuong. Thank you very much.
Thank you, Ahmed.